Thank you, Franklin, so much. And thank you for your outstanding leadership. And thank everyone here at the National Foundation for Cancer Research. Our gratitude to each of you for your life-saving work. There's nothing more important. If I were to tell you that there was a killer at large in our communities that would attack 1 in 3 Americans and tens of millions more worldwide, would this killer be on the FBI's most wanted list? No, because that killer is cancer, an international enemy that requires the mobilization of all sectors of society, including our very best scientific warriors, to defeat it. From your establishment in 1973, the National Foundation for Cancer Research has been at the cutting edge of cancer research, expanding the frontiers of science as we seek to better understand what causes cancer, how to cure it, and importantly, how to prevent it in the first place. You support high-risk scientific exploration, but these studies come with high rewards. So thanks to advances from such innovative research, we now have an entire generation of people who are cancer survivors. They display incredible courage every day, and so must the people who conduct life-saving research. The distinguished scientist receiving tonight's prize for progress in cancer research embodies this kind of courage, vision, and leadership. Dr. Frederick Alt is extraordinarily creative and curious. He is committed to finding the chromosomal keys to unlock the mysteries of cancer. Of course, I have my own bias, since Dr. Alt is a graduate of Brandeis University, which is just a few miles from my home. He is also currently a rock star of science, serving as the Director of Cellular and Molecular Medicine at Boston Children's Hospital and as a Professor of Genetics at Harvard Medical School. Dr. Alt's groundbreaking work to beat cancer is proof of what my mother used to say. Whenever she was disappointed in me, whenever she felt I was not meeting her expectations, she would say, "Eddie, I'm going to donate your brain to Harvard Medical School as a completely unused human organ." And when you're growing up in Malden, and Harvard Medical School is just 3 miles away, you know that's possible. And after she would say that, she would always say, "Eddie, you have to learn how to work smarter and not harder." And that's what research is all about. That's what you're all about. And again, I grew up as an Irish Catholic politician. The Immaculate Conception Grammar School, Malden Catholic, Boston College Law School, get ordained or take the bar exam at that point. And then the way the world has changed, I married the dream. I married a Jewish doctor. It's the way the world has moved, And my wife retired as a 2-star admiral as Deputy Surgeon General of the United States after her career as a researcher at NIH and at the Department of Health and Human Services. And what I learned over these 30 years with her is kind of how much of a higher pedestal, actually, that medicine is on than politics, in terms of its overall importance to our society. And that's why we honor Dr. Alt this evening, because for more than 4 decades, he has shaped the very foundation of modern cancer research. His pioneering work on the molecular mechanisms of DNA damage repair have led to a greater understanding of the ways that cancer develops, which has provided a roadmap for discovering bold new ways to contain the disease. Dr. Alt's landmark work has ushered in the new era of genetically targeted therapy and personalized medicine. For many scientists, interest in research is sparked by a teacher or an internship. But Dr. Alt's passion was born from personal experience and loss. Both his mother and father died of cancer by the time he was 11. And from that point on, he decided to spend his life working to defeat this disease. It is that compassion and dedication that animates his work to save the lives of others. And for this, we are so grateful. My wife became a physician because she saw her mother die of breast cancer at Stanford Medical School Hospital when she was growing up in Palo Alto. And so she continued on and wound up being the head of all women's health for the federal government in the Clinton administration, just following that passion, knowing that people had to work on these problems if we were going to make progress. And Dr. Alt is that bright, shining star, a luminary in the constellation of cancer fighters in Boston, in America, and around the world. But these lights of knowledge, these beacons of hope for cancer patients and their families, they are not lit on their own. Their careers, their opportunities to shine are fueled by the support of organizations like the National Foundation for Cancer Research. Their work is also supported by the private companies that are making significant commitments to fund new cancer treatments, technologies, and prevention approaches. And these scientists are provided the opportunity to shine because the federal government, on behalf of the American people, has made significant investments in biomedical research. Dr. Alt and his brilliant colleagues in Massachusetts and around the country know and have experienced the value of these federal dollars. Massachusetts is #1 in per capita dollars awarded by the National Institutes of Health, directly supporting more than 35,000 jobs and keeping young people in that lane. These are the researchers who are searching for the newest breakthroughs, the best treatments, and conducting groundbreaking studies that move us closer to cures and prevention strategies. And across the United States, everyone is benefiting from investments in NIH. In 2012 alone, NIH funding supported more than 400,000 jobs at 2,500 institutions and small businesses nationwide, many of them 21st century biotech jobs. Consider this, that 1 year's investment in NIH research generated more than $57 billion in new economic activity, nearly doubling the American taxpayers' investment. And furthermore, NIH serves as the foundation for the entire U.S. medical innovation sector, with a total employment impact of 7 million jobs and exports of $90 billion in goods and services. But sadly, support for scientific research in our country is fragile. For many years, the NIH budget and medical research was not a priority. But 15 years ago, Congress and the Clinton administration temporarily reversed the downward trend, doubling the budget of NIH in 4 years, and President George W. Bush completed that trajectory. But unfortunately, like some cancer remissions, this positive development lasted for just a few years. Starting in 2003, as a result of inflation, the NIH budget, coupled with the $1.6 billion reduction mandated by the sequester, has resulted in a 20% cut over the last 10 years in the NIH's purchasing power for new grants. When Congress doubled the NIH budget, nearly a third of the qualified research ideas submitted to NIH were funded. Now that number is down to 14%. 1/3 down to 14%. And alarmingly, the average age for a first NIH grant today is 43 years of age. And this means that we are losing a generation of brilliant young scientists needed to conquer cancer. And think about this. There has been a 5% decline in America's research and development spending over the past year as compared to a 15% increase in China and a 5% increase in Germany and Japan. America's declining investments in R&D puts our scientific infrastructure and competitiveness in serious jeopardy. You have to put the R into R&D if you want to be successful. We truly need to fully fund NIH. At $32 billion a year, yes, but better to once again double the NIH budget so that we keep all of those young, talented people inside of this system, advancing Dr. Alt's advancing all of the research which you have created as the foundation. The National Institutes of Health are really medicine's field of dreams from which we harvest the findings that give hope to families that we will find the cures for these diseases which have ravaged their families for generations. Not just cancer, but diabetes and Alzheimer's. It is where we develop the vaccines like that can stop Ebola or malaria or AIDS. In the 21st century, we don't need a mission to the moon. We need a mission to the mind. Okay? We have to fund now in the 21st century that which is the last pathway within our society, ourselves. That is what we have to do. And that is our challenge as a society. Each year, because of my wife, I'm invited to the Nobel Prize dinner that is held at the Swedish Embassy on the night before they all fly off to Sweden to receive their awards. And you can actually have a room with only perhaps 6 tables, and you can question them that night as they sit up there. And about 5 years ago, one of them was asked a question, which was, how will we compete against the Indians and the Chinese for Nobel Prizes 30 and 40 years from now? And the answer from one of the Nobel laureates was, we are up here now because of an investment made in us 30 and 40 years ago. But we do not yet know the wisdom of this generation as to whether or not they will make the same investment in science, in technology, in mathematics. That's our challenge. So Dr. Alt may be based in Boston, but his collaboration efforts and those of the National Foundation for Cancer Research are global in scope, spreading new knowledge around the world to improve our understanding of how cancer develops and how it can be treated and prevented and cured. After all, cancer may soon overtake heart disease as the #1 killer of people worldwide. We know there are significant geographic differences in cancer rates and types. For example, Japan has more stomach cancer. The United States has more colon and breast cancer cases, which is why we need to learn more about environmental influences on cancer globally and how they may affect our genes and cause them to misspell. And while it may be a regular practice for an American bank to set up shop in China, when the National Foundation for Cancer Research establishes a tissue bank in that country, it is a life-saving investment to better understand the causes of cancer in the most populous country on earth, paying dividends for other nations as well. And additionally, with big data and international collaboration, science and technology crosses national borders and are pillars of our foreign policy to fostering understanding, exchanges, and relationships in an increasingly interdependent world. In 1961, President Kennedy, as a result of the national security threat posed by the Russian Sputnik, vowed that America would put a man on the moon, would develop metals unheard of, and travel at speeds undreamed of. We would do so not because it was easy, but because it was hard. And America did it in 8 years. The flag that was flown on the moon from that mission now hangs in the United States Capitol as a symbol of the return on investment to the American people, of making that daring investment. So tonight, we know that defeating cancer is the moonshot of our generation. We have the scientific tools, the brilliant researchers, and what we need now is the political will and the funding. There is an ancient proverb that says, he, let us also make that she, who has health has hope, and she who has hope has everything. That is what tonight's honoree, Dr. Frederick Alt, and the National Foundation for Cancer Research amazing work is all about. You are providing hope for a healthier future, a future free from the threat of cancer for people in our country and around the world. And I look forward to working with you to ensure that those resources are there so that you can finish this job. Thank you all so much for what you're doing. Congratulations, Dr. Alt, for all of your great work.